The first thing that we are going to do is verify the physician orders, and then we're going to review the client's history for any conditions that would impair catheterization. We're going to assess pertinent lab results and check for allergies. We're then going to assess the client's weight, age, level of consciousness, ability to cooperate, and mobility of their lower extremities. If needed, we are going to delegate assistance with positioning and gather all of our necessary equipment. We're going to take the supplies into the room. We're going to provide patient privacy, introduce ourselves, and perform hand hygiene, and then identify the client using 2 patient identifiers. We're going to apply a pair of clean gloves. And then we're going to position the client. For females, that is going to be on their back with their knees flexed in the dorsal recumbent position and have the client relax their thighs. For males, they're going to lie supine with legs extended and thighs slightly abducted. Next, then we would drape the client so only the genitalia is exposed, and then we would clean the perineal area with soap and water, rinse, and then dry. We're going to remove and discard our gloves and perform hand hygiene. Next, we're going to place our catheterization kit on a clean surface and open the outer wrapper using sterile technique. Then we are going to apply our sterile gloves. And we're going to maintain sterility throughout the entire procedure. We also want to maintain integrity of our equipment. Next, we are going to apply a sterile drape according to the gender, and we must maintain sterility. Next, we are going to clean the urethral meatus with an antiseptic solution. Okay. Now we're going to lubricate and insert the catheter using proper length for the gender. If this was a male, we would insert by grabbing the shaft of the penis and insert 7 to 9 inches. But for this female, we're going to insert 3 to 4 inches. So we'll open up our lubrication. Remove this and insert the tip. While that is inserted, I'm also going to connect the saline solution so we'll be able to flush our catheter later on. Our equipment is now ready to be inserted. Now, while holding the catheter in place with our non-dominant hand, then we're going to inflate the balloon with our pre-filled syringe according to hospital procedure. With our non-dominant hand, we're going to separate the area and insert 3 to 4 inches until resistance is met. And we give it a light pull, okay? While keeping our non-dominant hand there, we're going to take our dominant hand and inflate the balloon. After inflating the catheter balloon, we're going to gently pull on the catheter until resistance is met. Okay? We're going to release our hand. We're going to secure the catheter onto the inner thigh. We're going to position the drainage bag and allow for free gravity flow and hook it onto our bed frame. We're going to cleanse and dry the perineal area. We're going to follow completion protocol while removing our gloves, removing all of our used equipment, placing it into the appropriate receptacle. We're going to observe urine in the catheter bag for the amount, color, and clarity. We're going to determine our patient's comfort level and document and report the procedure and findings. We're going to also help our client into a comfortable position, place the call light next to themselves, wash our hands, and document the procedure and the outcomes. And that's it.